Welcome to the second video in the Trans-Inclusive Healthcare series. In this video, we'll go over how to be mindful of the diverse backgrounds of your clients in your forms and record keeping, specifically in terms of name, gender identity, sex assigned at birth, pronouns, and sexual orientation. To start off, you should review all of your documents for cis-normative or heteronormative language. This might look like using pronouns in your documents like he or she rather than they, or making assumptions about the genders of the people your clients are dating or being intimate with. To help you in revising your forms, we recommend you check out Queering Medicine's intake form guidance linked in the description. We'll share a few recommendations for questions you can include on your forms that are based on their suggestions. Take a look at their website and resources for more in-depth coverage of how to approach these conversations in open and affirming ways. Trans and gender diverse clients may use a name different from their legal name. Of course, many people who are cisgender do not use their legal name in daily life either. Legal name changes can be difficult and expensive, and whether the name someone chooses to use is their legal name or not does not affect the validity of that name. Avoid using terminology like preferred name, because this can be considered offensive. Only ask for a person's legal name when absolutely necessary, and include a small note on forms explaining why you need their legal name, like this. So why is this important? For one, calling people the name they go by is respectful and validating for all of your clients. It can be extremely difficult for trans people to hear their legal name, or as it's sometimes referred to, their dead name. So ensure to only use the name they go by when addressing them or when talking to your colleagues. In your records, make sure that the name they use is first, and instruct all staff to use that name and not their legal one. Ask your client what name should be used when calling their residents or sending mail, to protect their identity should they not be out to the people they live with. Printed materials, including but not limited to after-visit summaries and notes, should continue to use the client's name they go by and correct pronouns, unless they have specifically requested otherwise. It can be troubling to leave a visit to find that your provider was affirming to your face but misgendered you in their notes. Gender identity. Ask for your client's gender identity in a list format where multiple boxes can be checked, or as an open-ended question. The list format may be more appropriate for the purpose of data collection. Ensure that the list is inclusive, like this one. You should revisit the language on your forms every so often, perhaps annually, to make sure that your terms are inclusive and potentially add new common identity labels to your options. Only ask for a client's sex assigned at birth when it is absolutely necessary for care, and avoid terms like natal sex or more simply sex, as these are not as inclusive or clear. In your practice, it is important to remember that information like hormone levels, gender identity, gender presentation, and anatomy may not align with assumptions based on a client's sex at birth. When knowing a client's sex assigned at birth is necessary, you should use this format. Pronouns should be readily visible to staff in the record system, preferably immediately following or right below a client's name. Do not use the term preferred pronouns on forms. Again, this terminology is considered offensive. Here's a potential format for asking for pronouns. Notice that there's a space for the patient to specify their pronouns, and the form indicates to check all that apply. Both of these features are necessary to be inclusive. Gender identity and pronouns are not interchangeable. Someone who identifies as a woman may not use she/her pronouns, or someone who uses they/them pronouns may not identify as non-binary. To be most respectful, use they/them pronouns when a client has not provided their pronouns to you. Using someone's incorrect pronouns is called misgendering, and it is associated with increased psychological distress and suicidality. So, using your patient's correct pronouns is actually associated with better health outcomes. Many people make assumptions about the sexual orientations of transgender and gender diverse people, or operate on outdated stereotypes. It's important to ask openly about clients' sexual orientations to avoid harmful assumptions that can negatively impact care. Sexual orientation does not necessarily indicate other metrics like frequency of encounters, number of partners, gender of partners, or type of sexual practices. It is also distinct from romantic attraction. If you need specifics on those metrics, check out the Queering Medicine link in the description for more information. Here's a potential format for asking about sexual identity. These tips are for adults. If working with youths, ask the client these questions in a private conversation, and ask what terms you should use to describe them when speaking with their parents or guardians. All of these categories are subject to change over time, so devise a system to keep these metrics updated. If you're in a setting that also conducts research, the questions we've presented here may need to be modified to make data collection consistent, or to facilitate identifying subgroups related to gender identity with more ease. If that's the case, you should still strive for inclusivity, and we have several recommendations in the description for ways to structure these questions. When you take these steps, you are setting up your clients to have a more positive experience overall. Clinic staff, other providers, and you will all have better rapport and more inclusive exchanges with clients as a product of using more inclusive forms and record-keeping processes. Thanks for watching.